I am very delighted to be a part of this conference on peace education and how it's not limited to theoretical concepts, but also encompasses practical examples. My name is Nantongo Betty, and I'm very, very passionate about community work and projects that enhance peace and uplift the status of women and children. I am an alumnus with the CECF and currently working as an intern coordinator within Uganda. And I'm very, very glad that Imam Arafat, when he came to Uganda and conducted the last Better Understanding for a Better World conference, I was amongst the paid for participants. And he was very pleased with my work. So he asked me to continue working with him. And I was really, really excited because I was so much inspired by the work that he was doing at that time. And that kind of inspired me to go out after the conference to start a project that directly addresses cases of sexual violence within Uganda. So I am currently co-founding a youth-led, actually women-led NGO, which currently supports victims and survivors of sexual gender-based violence. I am a poetess, so I like to write poems, I like to recite poems, and I use my poetry skills to teach young people. But for me, it's a form of advocating for peaceful communities, especially when it comes to cases of sexual gender-based violence. So before I go into my full presentation, my topic today is going to be about COVID-19 and how it has increased on the cases of sexual gender-based violence. I would like to first of all highlight the background of the reasons why I'm really, really interested into this field. And I would like you to all see the relevance of joining efforts to support to address cases of sexual violence, because even if we advocate for peaceful communities, peaceful homes, if these cases within our homes, within our communities are not addressed, we might still be failing to realize peace. So currently I'm going to share my screen. Are you able to see my screen?
Yep.
Okay, beautiful. Okay, so that's me. That was my recent picture before the coronavirus. I was attending an international summit on the Girls Not Brides Summit. So I would like to quickly give a brief background, like I mentioned earlier, about how the world is waking up to the fact that sexual violence is wreaking havoc on the lives of women and communities in conflict zones. And this poses a real threat to the lasting peace that we are all trying to advocate for. Though as we upload this growing international consciousness about how sexual violence stands in the way of progress, we can't help but wonder when many people will have the same awakening. So as cases of COVID-19, the disease caused by the coronavirus, which has kept all of us in our homes that we can't even meet up physically to discuss these issues face to face, as it is, increasing in many, many countries, there's like a consistent threat that is being posed onto the people when it comes to peace and stability within our communities. So I would like to quickly give you slight statistics about what's been happening in Uganda after we all went to mandatory lockdowns within our community. And as you can see, these are like statistics which have been given, the research or the cases that have been reported to the police during the lockdown. So over 6,800 cases of defilement have been recorded. That is a huge number. When we talk about defilement, we are talking about children aged below the age of 18 years. And what is most shocking is that 64 of the people, the perpetrators who, victimize these young people were their parents. You're talking about uncles, fathers, mothers. You're talking about all those people who stay in the same homes as these young people. Then we are talking about teachers who are supposed to be the give them. I was following some of the presentations, and some of the thing that really interested me was how people say that it's important to go through schools, the peer educators, the teachers, to be the change agents when it comes to advocating for peace. But it's unfortunate enough that for us here during the lockdown, we've had cases where teachers have actually been the ones victimizing the young people. Then there's been a lot of people living with HIV who probably have been frustrated. They have actually gone ahead to defile young people. Now, if at all, we are also addressing HIV cases, which are quite high in Uganda. Now, HIV patients are the ones going out to start sleeping with young children. That means that we cannot be able to curb the cases of HIV because the cycle of defilement is continuing every now and then. These are all like different news everywhere you turn. There's just news about school teachers raping their children, fathers raping their children. Every single corner you move to after during this lockdown, you hear a case about rape, defilement. And I want to quickly give you a simple scenario before I proceed into our work. Now, immediately after they put Uganda in lockdown, in my community where I work, we had an incident where 2 nurses were coming from a government hospital. They were supposed to be going home earlier, but at that point they couldn't because the public transport was banned. So then they were trying to find their way home. So on their way home, they were actually raped. So when we tried to follow up on this case, we were silenced from the hospital because then they realized once this story goes out in the media or in the news, it's going to put such a bad image on the hospital because of the negligence that they put. They didn't put any provisions for the nurses who have to wake up very early in the morning to go to the hospitals or work very any of that of the transport means. So up to now, we are still trying to follow up on this case, much as we're having a lot of resistance from the hospital, but we hope that at some point in time we shall be able to get justice for these young women. There was also like a scenario which happened in my neighborhood about a boy who's a brother to these 2 girls who defiled them and then they became pregnant. Now, you may wonder, when we're talking about peace in their homes, how can you protect or expect your children to be peaceful or live free from violence in their own home when the perpetrators are also living within their own homes? So now it could be a question of, are people aware? Is the education providing good enough? What do we need to do to address these kind of problems? So sexual violence being such a big deal in Uganda, it is very upset to note that many of the people don't actually talk about sexual violence, an open secret, that I like to call it, because you hear about it, but then most of the times you don't actually hear about it in the public spaces. And much as we have very many laws in our constitution and we have the legal processes, it is absurd to note that most of these processes don't happen the way they should, which makes me really, really sad and kind of encourages us to wake up every single day to go and do the work. So quickly on the impact of how COVID has affected women before I kind of hint on to what we are doing to address. As we are all aware that most of the primary caregivers are women, which means that they are more exposed to the risk of getting the coronavirus. The closure of schools, up to now, they've only opened the candidate classes, but children have been kept at home. These confinements have increased the much more burden for women and girls because in Uganda, women are kind of expected to be the primary caretakers. So all the burdens, everything that comes with it, that it's kind of being taken on by the women, and the cases of poverty are on the rise. When we look at the different coordination platforms on the national and district levels, the task force is mainly male dominated, which means that even if women have their own rights their own needs that need to be addressed in the course of the crisis, it means that those will not be listened to because the people who are on the forefront of addressing the coronavirus are mainly men. So most of the decisions making power are kept onto them. So girls and the women are kind of kept on the side. There's been limitations with women accessing sexual reproductive health and rights, which has also made it worse for the victims because let's say someone has been violated, it has been really hard in this lockdown to access the police to go and report those cases, which has also made like survivors cannot even be able to access, let's say, medical help. And we've had a lot of young people getting pregnant in the course of this pandemic, which makes me worry because Uganda is already a young generation. Over 77.7% of the population is young people below 35. Now, this lockdown, what it has done, it has increased that number because children have been home frustrated. Many of them have been impregnated. They cannot go back to school, so they're all stuck in that cycle. And government, for some reason, hasn't been prioritizing efforts to address those other social problems that have come due to the effects of COVID-19. The numbers, of course, like I mentioned earlier, the numbers of rape and defilement have been lower in terms of the reporting, but it doesn't take away the fact that the numbers are actually high. This is because people here don't really treat rape or defilement as a serious case. Usually families negotiate those kind of cases because if someone hears, oh, this one's family's daughter was defiled, it brings shame on the family. So what they do, they sit down, they negotiate, deal is closed. And then they, of course, perpetrators tend to give money to the family of the victim, and then the cases go silent. Another thing I wanted to quickly mention, many of the organizations like us who were directly responding and preventing the rise and cases of sexual gender-based violence, we haven't been doing as much because of the restrictions that the government put in place. We had to stay home, we had to close most of our operations. Even the people who used to come to our places of work, or even the communities where we used to go, we couldn't do that because the lockdown kind of made everything hard. So survivors stopped their psychotherapy. Most of them stopped getting their medications. We couldn't run any training programs. So everything was kind of affected simply because the government didn't give much priority to addressing these social issues, like I mentioned earlier. We have a referral pathway, which was developed by the government and the Ministry of Health, but unfortunately, it's not very operational, which means that resources are not as available to support sexual gender-based violence cases. Most of the resources by the government have been injected into prevention of the coronavirus, which again leaves another bigger group of people living with HIV, people with cancer, people with malaria, all those other problems kind of on a standstill because most of the resources were taken away and then given to prioritize the coronavirus. So all that said, I want to quickly introduce why we do what we do, why I do, and Imam Arafat is one of the person that has encouraged me to go further every single day because of his advocacy for peace. I believe that peaceful communities will bring peaceful. When we have peaceful communities, we can live free from all this extremism, all the terror, everything else, because then we understand diversity, we respect and love one another without any problem whatsoever. So this is our team. And we are youth-led. Most of the women I work with and the girls, some of them are survivors of sexual gender-based violence. Others are boys living with HIV. Others are poetess. Others are different. We have like a diverse group of young people. And one thing that we have in common is we work to uplift the status of our community, but not forgetting to create change that enables us to live in peaceful communities. We run several campaigns. We ran several trainings and advocacy campaigns. This was our very first campaign we ran in 2018, where I personally found a girl who was gang raped. She was 12 years. I'm sorry, this story might be a little bit triggering if there's any survivors of sexual violence, but kindly allow me to share quickly about it. I found a girl of 12 years who had been gang raped, and then after they got an orange, like an orange fruit, and then they inserted it in her private parts. Now, this actually made me realize that we don't live with human beings, we live with monsters, and it's one of the reasons why which encouraged us to wake up to conduct the first ever campaign in our community to just denounce the malpractices of sexual violence, because people are very religious in a sense that, you know, when you talk about God, it's good. When you talk about going to church on Sunday, Saturday, going to the mosque on Friday, but when cases like this come, no one ever comes out to address them. So we run several, our overall goal is to contribute to a community where young women live free from any form of violence and have access to healthcare, psychosocial support, and legal aid in cases of abuse. Now, those three areas are what we work on, because usually when someone is a rape victim, they tend to pay for their medical care. So what we do, we try to advocate from the government to provide care, medical care for free. That includes doing the pre-exposure for the HIV virus, giving the anti-pregnancy tablets, and also making sure that if the victim has been badly wounded, the government can provide those fees for free. We also provide psychosocial support. It's not something that is usually included in our communities. People think now you can deal with it after all. You know, they assume automatically that you're going to heal. So what we do, we have these young people, young women come to our places of work. We have different activities, mentorship, crafts, poetry, writing sessions, a lot of things that we do to help them tell their stories, express themselves, express their anger, because we believe that that is a journey they can use to heal. We work with various partners. This is quickly just some of the pictures of the different campaigns we have run. We work with the different schools. What we do with the schools is we identify mainly in secondary school. We have peer educators whom we train with the right information for advocacy against gender equality and sexual violence and HIV. And those young people are the ones who again become the change agents in those communities, because our capacity is still small, but we try to work within the existing resources. We work with religious leaders. What we do with them, because we believe people in Uganda believe in their religious leaders. So our role is to involve these religious leaders. We explain to them, we run some trainings with them. Of course, most of them are aware, but somehow they're negligent to talk about cases of sexual violence. So we introduce them to a new way of talking about it to their crowd, such that if at all cases like those come, first of all, people can seek help, especially the victims, but also the cases can be reported. We lobby for support as well from a wider community, because we as a network of young people, we cannot do everything by ourselves. We don't have the capacity, we don't have the means, but we know agencies and organizations that have the capacity to do so. So we identify them. When we know we need medical help, we have an organization we contact. When we know we need legal aid, we have an organization that we contact, because then that way we are creating synergies that help us to support this victim, and also ensuring that we can get justice and continuously educate our communities about the dangers of sexual violence. Like I mentioned earlier also, we do use poetry. And for us, poetry is first of all a form of expressing our concerns, you know, through the art of writing, reciting, and we do performances in the community. So we create our messages for advocacy, and we use poetry as a form of entertainment to reach out our messages to the rest of the group. But also it is a way for us to enable the survivors to express themselves, to express their heart, and then to allow them to heal. That was one of recently we conducted the 16 days of violence, and that was the district police commander, because we partner with the police. We realize if we keep out the police, we are not going to be able to execute the work, because these are like the main providers of security and legal justice. So we work hand in hand with the police to help us go through the process of the legal requirements. So we do sensitization, but also we do response. With response, when someone reports a case to us, we provide, we make sure that they receive medical help. Usually people have not been getting money, and the government has been still failing to pay. So we tend to run, how do you call them? They're called fundraising campaigns online, where we create, like if a case comes to us and we don't have money and probably it's a big operation, we run fundraising campaigns, and then we are able to solicit for money to help this young person get the medical treatment. We also do, like I said, provide contacts or referral pathways for the legal support. We do provide a safe space, because for us, we don't call our offices an office. It's a home where we have gardening, a home where we have a bed you can sleep, a home where you can cook a meal, a home where you can literally feel at ease, a place where no one will judge you, everyone will treat you with respect. But most important part also, we use the media to amplify our voices when it comes to advocating for peaceful communities. We have a number of stories that have been featured on different national televisions. I wasn't able to capture them on here, but after the presentation, I can share some link to our work and what has been like documentaries that have been run. So just quickly, those are different trainings and facilitations that we have run different people. And as I'm about to conclude, I want to quickly highlight some of the challenges we are facing when it comes to this work. First of all, most of the health centers are not equipped enough to address the cases of gender-based violence. Usually, nurses treat a rape victim as someone who is like a pregnant mom, an expectant mom. So their needs are very different, but for some reason, our nurses, our health centers don't have specific places, or we don't have specific hospitals that like directly address cases of sexual gender-based violence. And then also people in the law enforcement usually don't look at sexual gender-based violence. I was involved in a number of conflicts with people at the police because I was trying to push for justice, explaining to the police why we need to proceed our files to the court. And I was invited several times on the side by the police and by the perpetrator's family to bribe me and the team that I had come with so that we can drop the cases. So now that explains to you why these cases keep on going, and we usually don't even manage to reach the court where we can seek justice. All the cases end at the police, they bribe everyone, and then the cases get dropped. Parents don't report. Like I said earlier, when they report, it damages their family reputation, and also they get threats from the perpetrators. And they're also having pressure from the police because sometimes they have to involve money transporting themselves to the police centers. Usually police officers want them to pay money, so it kind of makes them feel like it's a tedious process, so then they drop the cases. Community stigmatizes the victim. Let's say, for example, if I am the victim today and then I go to report to someone in the community, the blame is all going to go to me. I think this is like worldwide, or maybe some communities are doing better than us, but they will ask questions like, where were you? What were you dressed like? There's a lot of definition on the victim about who they are, what they were doing, how they were feeling, than why the perpetrator did so. And I guess most of it is based on the communities which we are living in are very patriarchal. There's a lot of religious influence, and I feel like sometimes religions also have been quite silent when it comes to these cases. So working hand in hand with the religious leaders is helping us to use that space of influence to actually educate people on, you know, their role in addressing cases of gender-based violences. We train teachers. This is one of the trainings that I was conducting with teachers from various schools, because we also believe that much as we are saying that children need to be empowered in a way or the other, teachers are also potential or big perpetrators, so we cannot miss them. We have to engage them in the work that we are doing. So we run various trainings with them, and it helps us to know that at least the right information is being passed on to the young people, and the teachers are also aware of the cases or the policies and frameworks that are available when it comes to sexual gender-based violence. So as I'm concluding, I believe we all have different views and different opinions about sexual violence according to our cultures and customs and norms and beliefs and whatever. Everybody should recognize and support women and girls, because if we don't realize that sexual violence is a violation of human rights and how much of its effect on the social and economic well-being, we will not achieve as much peace as we want. So I was reading one statistic sometime, and it said that if Uganda didn't have cases of sexual gender-based violence, we would be saving over 70 billion from our national budget, because there's a lot of money that apparently is allocated to addressing cases of sexual gender-based violence, even though we don't really see it. But imagine if the government didn't have to allocate all that money into sexual gender-based violence. They would probably be allocating into something that would be very, very much more helpful in helping our communities to thrive. So once we realize that sexual violence is a problem, all religious leaders, all politicians, everyone in their respective capacity starts from you to acknowledge that it's wrong. And then you pass on that same message to advocate for peaceful communities where our children will be safe, our women will be safe, and we'll all live in peace and harmony. Thank you so much for listening to me. And thank you, Mama Rafat, for such a big opportunity. And thank you for all the organizers of the conference for such an amazing opportunity to be a part of this conference.